Good morning, good afternoon, good evening. Welcome to Daily News on Breaking News, Everyday News on Prince Miller Entertainment TV. Today is the 5th of October 2021. Subscribe to the channel, guys. Remember to follow us on all our social media platforms: Prince Miller Entertainment on Instagram, Prince Miller Entertainment on Facebook, and Prince Miller Entertainment TV on our Facebook group. We are now available on Twitter. It's P Miller ENT. Yes, say. So let us hear, guys. South Africa's Public Health Department Directorate is started rejecting applications by health workers from Zimbabwe on grounds that its neighbor is currently facing a staff crisis due to migration. This was reviewed in a letter to some Zimbabwean applicants last week, which was signed by the South Africa Public Health Director of Workplace Management, Sindile Sodladla. The government of South Africa is obliged to adhere to all relevant protocols between member states of Southern African Development Community (SADC), the African Union (AU), as well as World Health Organization as it pertains to recruitment of health professionals from developing countries. So Lala wrote, these agreements, protocols, and recruitment codes were designed to prevent the uncontrolled recruitment of health professionals from countries where the public health system is faced with huge staff shortages, particularly with regard to health professional occupations. So Zala said all public health sector employment authorities described to relevant agreements, protocols, and recruitment codes. In view of the above, the department regrets to inform you that your application for endorsement towards registration and employment in South Africa was not successful. Your country, Zimbabwe, is not listed in the category of countries the Republic of South Africa Department of Health should recruit from. So Lala said he indicated that the copy of the letter would be submitted to the South African Immigration Authorities, Department of Home Affairs, as well as the South African Nursing Council. You are in your interest advised to familiarize yourself with the relevant immigration legislation and not to depart to South Africa to promote your application for support. The department will not be in position to reconsider your application once you have arrived in the country, Solala further stated. Migrant Workers Association South Africa Chairman Botolo Zinyati confirmed that some of the health professionals from Zimbabwe received such letters after they applied to be registered in that country. We are further applauded by the reintroduction of this regulation that was adopted by the apartheid regime. This seeks to limit the international freedom of movement by the people. We wonder whether the leadership of the South African government and SADC is pleased with the movement of the healthcare staff to the Western countries, whereas they could be remaining in Africa to save African people. Nati said. He said we would continue engaging labor federations like the South African Federation of Trade Unions and the Congress of South African Trade Unions, among many others within the SADC region, to create migrants' desks in their affiliates. Nyati said this would ensure that they facilitate the organization of migrants, including their movements within the SADC region, for better socio-economic activities. Zimbabwe Nurses Association President Enoch Dongo professed ignorance over the new development in South Africa. He said, if true, then it was against the SADC and AU protocols on free movement and deployment of Africans across the region. If it's true, I think it will be an issue of a department taking matters into its own hands because we do not have any agreement that effect in the SADC and AU, Dongo said. That is not in line with the protocol that we know, SADC protocol on employment and labor. We expect a protocol that allows people to move around and get jobs around the region. This has to be explained. Health Deputy Minister John Mangwiro said he was unable to immediately comment on the issue as he was logged in a meeting. The SADC Protocol on Employment and Labor 2014 enjoins member states to cooperate in all areas necessary to foster regional development and integration on the basis of balance, equity, and mutual benefit, including labor, with reference to, among others, social and human development and social welfare. So guys, that's the latest here regarding to the situation for nurses and who want to work in South Africa, maybe doctors included, and it's one of those things that as a country you need to first of all consider your citizens first before you can give job to other people. They say charity begins at home. So I'm not surprised about this decision from the health department in South Africa regarding to foreign nurses or foreign doctors or health workers who are coming from other countries, especially Zimbabwe. And so tell in the comment section. This is our daily news on breaking news on Prince Milan Entertainment TV. Remember guys to subscribe to the channel, follow us on all our social media platforms, Instagram, Facebook, and also our Facebook group. Remember guys to turn on the notification bell not to miss any of our new uploads. We upload each and every day, each and every hour here, keeping you guys informed about events happening in and around Zimbabwe. As long as it affects us, we have to talk about it here on daily news on breaking news. Thank you very much for listening and watching. Remember to subscribe, like, share, and comment. Yes sir, be part of us here on Prince Milan Entertainment TV. This is a daily news, breaking news, everyday news. Bless up.